Hello, my name is Devin Gutekunst, and I'm working with Julie Ponce Garcia on a systematic literature review where we research the efficacy of mindfulness-based interventions in treating PTSD in the veteran population. In this presentation, we will go over the research problem, the study purpose, research questions, major themes, and lastly, the methods that we utilized in our systematic literature review thus far. I will discuss the research problem of PTSD in the veteran population. Around 70% of the general U.S. population experiences trauma in their lifetime, with around 8% going on to develop PTSD. PTSD is a mental health condition that occurs after exposure to a traumatic event like injury, violence, or war. Post-traumatic stress disorder is characterized by extreme flashbacks and nightmares, hypervigilance, avoidance behavior, and long-term interpersonal and social adversity. Rates of PTSD in veterans are much higher than that of the general population, ranging from around 13 to 23%. 29% of veterans who served during Operation Enduring Freedom and Operation Iraqi Freedom have experienced PTSD, and some estimates show that the rate of PTSD in veterans can be as high as 34%. Veterans who are Latino face additional barriers to treatment for PTSD, such as language, social support, racism, discrimination, and other factors. PTSD has severe consequences for veterans. Some studies state that it may take up to 40 years to treat and mitigate psychiatric consequences that result from war. Veterans with PTSD are twice as likely to die from suicide and accidents. They're 3 to 5 times more likely to be diagnosed with major depressive disorder. They're 15 to 35% more likely to have chronic pain. And comorbidity rates of PTSD and substance use disorder are as high as 76%. Mindfulness-based interventions are described as a third wave of cognitive behavioral therapy and have been shown in research to be as effective, if not more effective, than other psychiatric treatment methods for depression, anxiety, psychosis, substance use disorder, and more. Mindfulness is clinically defined as moment-to-moment, non-judgmental awareness, cultivated by paying attention in a specific way to the present moment as non-reactively, non-judgmentally, and as open-heartedly as possible. MBIs, or mindfulness-based interventions, include mindfulness-based stress reduction, or MBSR, developed in the late 1970s by John Kabat-Zinn, which has been shown to be very effective in treating chronic pain and other physical and mental health conditions. Mindfulness-based cognitive therapy, or MBCT, has been clinically tested and shown to be effective for preventing relapse of major depressive disorder, as well as other mental health conditions. Dialectical behavior therapy, or DBT, is effective in treating self-harming behaviors, suicidality, and borderline personality disorder. Acceptance and commitment therapy has been shown to be highly effective in treating anxiety, depression, psychosis, and other mental health conditions. MBIs are, again, shown to be as effective as standard cognitive behavioral therapy, and they also have other additional benefits as well. MBIs have lower attrition rates, they're cost-effective or free, they're available for the rest of a client or patient's life once they learn the techniques and the intervention. They have minimal side effects, and very importantly, they do not re-traumatize patients by causing them to relive traumatic experiences.
Hi, Professor. Devon and I project focuses on looking at how mindfulness-based interventions, or MBIs, can help veterans who are dealing with trauma and PTSD. The main purpose of our study is to see how effective mindfulness really is in improving veterans' mental health, resilience, and overall quality of life. As we know, veterans often face unique challenges after service, and mindfulness might offer a more holistic and accessible way for them to heal. So Devon and I came up with a few research questions to guide our study. The first question is how effective are MBIs in treating PTSD in veterans? What impact do MBI have on mental health, resilience, and quality of life? What gaps do MBI fill in treating trauma and PTSD? And how do cultural values, systematic barriers, and stigma affect veterans being treated with MBIs? Overall, we really want to explore not just if MBIs work or not, but also how they can be adapted for veterans from different backgrounds. But to explore those questions, we conducted a literature review, which means we look to existing data instead of collecting new data. We use several sources like Google Scholar, Science Direct, PsycInfo, OneSearch, and the U.S. Department of VA Veterans Affairs website. And to help to keep our research current, we use articles from 10 to 15 years. And some of the key words that we use were veterans, Latino veterans, PTSD, mindfulness, mindfulness-based interventions, MBI, mindfulness-based stress reductions, MBSR. These help us find studies that show how MBIs are being used, what outcomes they lead to, and where they are still, and if they are still gaps, especially when it comes to minority groups such as Latinos. At the end, Devon and I goal is to highlight how mindfulness could be a valuable and cultural response tool for helping veterans heal from trauma. Thank you.